Our next speaker is Dr. David Yang. He's currently a tenured professor and chemist in the Department of Cancer Systems Imaging at the University of Texas MD Anderson Cancer Center. He is formerly the Chief of Radiotheranostic at the Department of Cancer Systems Imaging at the MD Anderson Cancer Center, and how he explained radiotheranostic to me is using radio imaging to provide individualized care for cancer research. So I think they brought him on to the Vyripharm team to do something similar with cannabis research.
Thanks, Zoe. Good evening. I'm delighted to be invited to attend such an important event. As you can see my background, I am an imaging person. So in the imaging scenario, we always want to see prevention, treatment, cure. So I think, I hope I can give this spirit to tonight's talk. So tonight I will mainly focus on the medical benefits of cannabis. Okay. As Dr. Jackson mentioned, how toxic is this cannabis? So when we start looking at the molecule, the first thing we need to look is the toxicity. So in the toxicity, as I put on the slides, it is about, with a 75 kilo person, it's about 21 grams. And this is based on intravenous injection, which is giving the most best the bioavailability. And if you give orally, we are talking about 1 pound, almost 1 pound per 75 kilo person. So it's not toxic. And there are known with almost 483 known compounds. So there's a lot of antioxidant in the marijuana. So as you can see, there are some known molecules such as CBD, we call cannabidiol, and there are some other CBN, and most important is the delta-9, we call THC, which occupied probably 20% in the overall the extracts from the plants, which is good. When you're dealing with the medical use, you want to have some clinical grade, and before clinical grade, then you really need to set up a reference standard. Then you have the clinical grade material. So the bottom line is low toxicity, high impact. Let's look at what are the known drugs that has been extracted from the marijuana. So I think many people probably know that, the Marinol. And I have patients coming to see us asking me for help because he needs more Marinol. He's feeling pain. He had the nasopharyngeal cancer. And he was asking, can I get more Marinol? Because all the other drugs are too expensive. Marinol is much cheaper. So this is one of the examples that Marinol is extracted from the cannabis in the plants. The other one is a similar analog called nabilon. So the FDA gives the indication of Marinol is based on the nausea and the vomiting associated with the cancer chemotherapy. That, of course, included with the AIDS patients. But when we look at overall that, who are the other people need the cannabis? That's what we also wanted to know. So I hope I can show you in the next few slides. And this slide shows currently what are the institutes involved in the clinical trial of using the marijuana. They are in the different phases, the clinical trial. To get into the bottom of the story, the pharmacology. In the pharmacology field, we always like receptor pharmacology because the receptor transporter, really you can predict the dosage. When you give the dosage, they occupy the receptors. When the dosage is too high, it will not work anymore. So the receptor is very important in the whole basis of the pharmacology for the clinician. The cannabis really binds to the, we call the cannabis receptor. In the brain, we call CB1. Below the brain, we call CB2. It's like a herpes. You have a herpes simplex 1 and HSV2. So one is in upper, one is at the lower. So CB1 receptor is really at the CNS, in the all the striatum, the basal ganglion area, and the CB2 is mostly at the peripheral. So by understanding the receptor, not only look at your imaging at the left side, it's really an autoradiogram. What it shows is an autoradiogram of the radio labeled, C14 labeled cannabis Where are they located? You can see there's a lot of the nucleus in those yellow dots showing the nucleus. So what it means is the cannabis indeed working in the brain and slow down the firing. On the other hand, it's really helping the release of the dopamine. So let's start talking about the potential benefits of cannabis. And of course, the most important is, when you are helping some patients that they cannot help by themselves, such as Alzheimer. In Alzheimer patients, they don't eat. So it's difficult, you have to feeding them. So one potential application for the marijuana is to induce the appetite. So that's one of the advantage. You can use the cannabis for enhance the appetite for the Alzheimer patients. The second one is, Dr. Jackson mentioned, is really for the antipsychotic. It is very important when you are using the many drugs, they induce the depression. And depression causes the suicide, lost a lot of young lives. And this marijuana really release the dopamine, so you heighten the mood. So it's an antidepressant. And thirdly is the anti-anxiety, we know that. And it relieves the pain, that's what we all know that. And it's give the muscle relaxant. That's what they call the recreation drug. And of course, the major metabolites, the THC, is very useful for the dopamine-related disease. In most neuronal disorder, especially dealing with dopamine, they are the dopamine deficient, such as Parkinson, Huntington, some of the ADHD, PTSD, all those are dealing with a lower level of the dopamine. So you want to boost the dopamine. That's how the marijuana, this drug, can help. Okay. And continued on the medical benefit, as I mentioned earlier, this plant has 483 compounds in there, so it's a powerful antioxidant. Most of the plants, vegetables, fruits, they are antioxidants. That's why we ate them and thinking that will help us to prevent a lot of disease. So it is a powerful antioxidant. Not only that, it is a powerful anti-inflammatory material. So certainly it is a neuroprotectant. And there's another report on the cannabis can reduce the ocular pressure for glaucoma. We talked about the nausea, vomiting in the chemotherapy, and we have talked about the anti-seizures, and we talked about the relief the muscle spasm in Dr. Jackson's slides, and some other things like if you really giving a dilation of the alveoli in the lungs, and giving a deeper respiration. And most importantly, I'm in the Cancer Institute. We are interested in looking at how would this molecule be useful in anti-cancer events. In the cancerous, we know cancer is a lot of dealing with your immunological function. So when you have immunodeficient, you are easily get easily being infected or inflamed. So certainly this is the molecule is involved in the calcium channel blocking, so that slow down your immune response. So that is another way looking at the anti-cancer, and we know the cannabis is useful in the treatment of prostate cancer, lung cancer, lymphoma, breast cancer, and there are multiple reports on this. Of course, there's no single agent is perfect. Every single agent, I'm also looking at the adverse event. The adverse event is not that bad. Of course, one is you have a transient loss of the short-term memory, and you have the dry mouth, which is very typical when you are using the medicinal natural plants like atropine, like scopolamine. Those are the things that easily you can see the dry mouth, and you do increase the heart rate through the SA node, and you do lower the blood pressure due to the nerve blocking on the ventricle of the heart. So it's very interesting molecule to me, and also it has given some impact on the motor skills as well as reddening the eyes. By looking at the opportunity, how would we use that as a translational tool? Means from the laboratory to the clinic side. I think there are several things we can look into. One is certainly the cognitive improvement. Secondly is on the neuroreceptor mapping, cancers, and movement disorder. As I mentioned, all those movement disorders are associated with a lower level of the dopaminergic activity. So this is the molecule that really release the dopamine. So it helps the Parkinson, Huntington, PTSD, and ADHD. And certainly it has certain antipsychotic disorders, improvement, and epilepsy, neuroinflammation, and PTSD. So in a summary, I was hoping to show you some images, but I think we took it out. I wasn't sure how long is the talk because I was in Asia, just come back on Monday. So in a simple summary, I think most important thing, anytime when we are dealing with a new things, which is from illegal to legal, the first things we need to do is a tracking system. So on the other hand, the step one is we need to build up the reference standard of the desired molecule. So we understand this is so-called medicinal product. That means you are looking at the clinical grade. So the step one is from extracts of the plants, we need to quantify the purity of the material and set up a criteria of how pure we can use that in human as a medicinal product. Say, if you say, well, 90%, FDA may say, how about the 95%? Then you may be able to say, well, how about the 92%? That's the best I can come up with. So we are all the taxpayers. They are supposed to help us, not to destroy us. So I think one thing is we need to set up the standard. And once we have the standard, we are able to do put into the emerging technology. I am very much interested to take this molecule to transform to be an imaging agent. Only in the imaging agent, we call it personalized medicine. You will be able to select the patient who will respond to the treatment. As you can see, we talked about so many potential benefits, but how are we going to select the patient who will benefit for the treatment by THC or CBD or by marijuana? The only way you can do that is by imaging. So I think that's very important. I hope we move this into the legalized. If it's not legalized, even I do the imaging, who will be benefit? So the key thing is to get a reference standard first, then get into the emerging technology. And I'm sure we have many talented people in here, many heroes in America, and that's what we're going to make it happen. To get into the imaging to the patient. And lastly, in today's science, we are all looking at the metabolomics. In other words, in single biochip, we'll be able to monitor who is a person on the marijuana, who has been the person on the marijuana. We'll be able to differentiate that. It's just like today, since the alcohol is already well controlled, so we know by breathing the air, breathing from your air breath, we are able to detect how much alcohol you have. In the future, it will be the same way. We need a better tool to tracking. Then we will be able to differentiate that. And I think we need to make this to be legalized. Otherwise, we talk about all those medical benefits will not be powerful enough. So thank you.